I'm Julia Borsten here for Tech Check with Heather Fernandez, CEO of Solv Health, a health tech company that has just raised a new round of Series C funding. Heather, thanks so much for talking to us today.
Julia, thanks so much for having me on.
So, new Series C investment. Tell us how much you've raised and who these new investors are.
We've raised $45 million. The round was co-led by A-Crew, Teresa Gao, and Corner Ventures, John Catadoo. And of course, we have the support from our existing investors, Benchmark and Bill Gurley, as well as Greylock and James Slavitt. And we're just super excited about it.
So before we get into what you're going to do with this new funding round, tell us a little bit about what Solv does and how your business has changed and expanded over the course of the pandemic.
Of course. We founded Solv with the belief that everyone deserves to be free from the stress of everyday healthcare. I'm a mom of three. Julia, I believe you have two at home. And the reality is, it is not easy. It is not convenient. And ultimately, when you think about the American health system, it is ripe with opportunity for improvements and change. And so that was our focus. What we've done over the past few years is we've built a national network where 100 million Americans are within 5 miles of a bookable Solv appointment today. 1 in 16 Americans have actually booked an appointment. 80% of those are same day through Solv, which has landed us in this incredible place where we can actually pursue our mission to reduce that friction as we grow.
And now you're linking people not just with regular doctors, but also with telehealth. How important is telehealth to the business, and how important do you see it becoming down the line?
It's incredibly important. When we think about the questions we're trying to answer for a consumer, it's very simple. Where should I go for the problem I have? And that might mean my couch. When can I be seen? And how much ultimately is it going to cost me? Telehealth really became a significant driver of our growth during the pandemic. In fact, Julia, in 2019, prior to 2019, we had something like 9,000 total telehealth visits across the network. Since then, we've seen probably 1.5 million. And so it's become a much more significant overall proportion of care. And the reality is, when you think about the future of healthcare, telehealth, whether that's a virtual synchronous visit or talking to a provider via text message to get what you need, will become a larger and larger portion. And we're going to be investing there to enable providers to meet consumers where they are.
So tell us where you're investing. Where are you going to put this new $45 million round? Where is that going to be put to work, and how will that help change the company?
Well, the reality is, when you're a startup like Solv, your number one investment is in your people. So incredibly talented people. I'm so proud of the last year. We have people coming from great healthcare brands like One Medical and Verily and Banner Health, as well as great consumer brands like Zillow and Square and Instagram. So people is our number one investment. In terms of the product experience, we have really invested in growing that network that I described, and we'll continue to do that. Right? Everyday healthcare for millions of consumers includes everything from urgent care to primary care, women's health, mental health, right? The expansion is significant. But second, we'll really be investing in that consumer experience. Those three questions that we talked about from the second we raised our first dollar: where should I go for the problem I have? When can I be seen? And how much does it cost? And enabling that in an incredibly elegant way through the Solv experience.
And so your goal is to make it easier for people to book healthcare appointments, to get to those doctors. How important has the whole COVID pandemic been to convert people to new tools of how they access health? Whether, I know you made a big push to help get people tested through your system. How have you sort of seen this as an opportunity to convert people to new models of healthcare?
The reality is, we were building for the future of healthcare, and COVID really pulled that future forward and accelerated so much of what we were already working on, right? So one of our initial beliefs was that consumers were really optimizing around quality, access, and convenience, and that it was really breaking up the traditional paradigm that every doctor visit, every experience when you are sick or need something, needs to be conducted in exactly the same way, right? Taken one level up, Julia, there's this disaggregation of healthcare that is born out of frustration, whether it's from policymakers or the biggest health systems, and most importantly, consumers, which is enabling consumers to get more of what they need when they need it. And so, to be very specific, COVID accelerated our ability to grow our overall national network and work with partners. It significantly grew the number and volume of consumers that were coming to Solv for same-day care. COVID testing in particular, something that you just mentioned, we did something like somewhere between 8 million or so COVID tests were powered through our network. I think we were second only to CVS in that case. And so it just really accelerated what we were already working on, enabling us to work with millions of consumers in their everyday healthcare.
And it seems like this is an essential moment to convince everyone, whether it was patients or doctors, that these kinds of appointments and everything just sort of needed to be figured out digitally, as opposed to someone picking up the phone and calling their doctor. But I'm wondering if you could explain to us sort of what the business model is, how it works, and who pays you.
Absolutely. In our pursuit to reduce the friction around everyday healthcare, our approach was, let's work with the providers that exist across the country and empower them with a more consumer-centric experience, right? There is a myth that hospital systems and providers are not trying to deliver a more modern, more convenient, better access within the experience. But the reality is so much of that capacity has been locked within old technologies and old workflows. So what we sell and how we monetize is software for providers, health systems, urgent care clinics, primary care physicians, in order to enable them to have a digital first experience for consumers. Everything from that online booking to SMS-based communication, video telemedicine, digitizing all of your paperwork, really reducing all of the friction that comes with getting access to care. And we sell that to providers on a monthly basis.
So with that in mind, as you look ahead towards the rest of this year and towards next year, what are your expectations in terms of the additional numbers of providers you'll be able to sign up, and then also the additional number of consumers you're going to be able to get to use your service, and what your strategy is going to be to market to both of those constituencies?
Oh, absolutely. The way we think about our provider network that is on Solv is how many consumers are how close to care. And so I said a bit earlier, 100 million Americans today are within 5 miles of a bookable same-day appointment, right? That is incredible. And we are so much more ambitious than that, right? Within the next 12 months, we're looking to increase that number to 150 million Americans. But of course, our goal is that every American is able to get care on Solv, whether that's virtually, via SMS, via video telemedicine visit, or because there is a location that is 5 miles from them in their home, in their community.
So it's really just getting the message out there. But I'm wondering if you think in terms of what's happening right now in the health tech space. Obviously, you're working with some big name investors. Bill Gurley is on your board. What are you seeing sort of more broadly about what's happening right now in this moment for health tech?
You know, it is really a magical moment in health tech, Julia. I was reading a report from Rock Health. It said something like $15 billion was invested in the first half of 2021, which is double the investment in health tech in 2019, the year before COVID. And you're really seeing investment across the board. One big theme really is this disaggregation around the traditional healthcare offering and meeting consumers where they are. So you see things like mental health apps for pediatric care delivered through your employer. You see things like an SMS or virtual visit to get your birth control pill. And then you see things like Solv that are really empowering providers to deliver a more modern consumer experience, connecting consumers with those providers today, right? And so you're seeing innovation everywhere. And it's because of this incredible confluence of consumer frustration and a demand for change, and policymakers and some of the largest players all looking at the American healthcare system and saying, it's time, right? It's time. $3.5 trillion in cost and growing is not a sustainable paradigm really for any industry.
And as you look ahead to the future, hopefully in the incoming months, people are going to be able to get out and about more, return to some of their behaviors from pre-COVID. Is there a risk or a chance that the shift towards digital healthcare services slows or stops, or whether this is sort of the maximum capacity for digital healthcare, or do you think this is a permanent sea change?
This is absolutely a permanent sea change. Now, what's important to underscore is that doesn't mean that consumers are no longer going to a doctor's office. That is, of course, one component of care. But if it's my son who has a rash, or my mom who's managing her severe asthma, or my co-founder who fell off a bike and needs care, all of those are different needs. And the reality is technology is not the solution. It's an enabler to enable more access where consumers are. And that is not going away, Julia, right? There are a lot of things still to be figured out around reimbursement rates for telehealth, around providers and changes in workflow. But the reality is that, that train's left the station. And really what's left is an evolution of that healthcare paradigm to one that enables more access, more convenience, and more transparency. And will look different whether you are my son, myself, my co-founder, in your experience with care.
Well, really amazing to see what a transformation the healthcare industry has had during this pandemic. And Heather, great to hear your perspective on this as you announce your Series C $45 million round. Thank you so much for joining us. Heather Fernandez, CEO of Solv Health. I'm Julia Borston for Tech Check.